Good afternoon, everybody. It's a pleasure to see you. My name is Steve Keller, and I am the program developer and national speaker for Drug Free Kids Canada. I'd like to take a moment to thank you for joining DFK today for this special presentation designed for the country, but being presented today in partnership with CMHO, Children's Mental Health Ontario, to help guide and prepare parents and guardians for supporting their teens, especially during this time of the year. I mean, we're coming into late spring, early summer. We have many youth that are about to go off to formal events, whether that be proms, whether that be social gatherings, whether that be field parties, whether that just simply be celebrations, social occasions. And as your teen is celebrating this very, very exciting, very energetic period with hopefully some beautiful weather, our goal is to make sure that the nights that they spend out are nights that they can remember for, shall we say, the right reasons. Now, before I get too much into the details of what those are, I do want to take a moment to acknowledge where I'm presenting from. I myself am living in beautiful, kind of chilly downtown Peterborough, Ontario, upon the Anishinaabeg territory adjacent to the Haudenosaunee territory. I myself grew up in Belleville. I've been very, very fortunate to spend time in my youth in Tyendinaga First Nation. Getting a little bit older, doing the work I've done the last 10 years, I've been able to attend events in Curve Lake, Alderville, Hiawatha First Nations, spending a great deal amount of time working with their family health teams, their NADAP, National Native Alcohol and Drug Abuse Program workers. And I do strongly encourage those listening to take the time to learn and certainly connect with their Indigenous providers and their Indigenous communities around them. And they're all across the province. I've done presentations in Cornwall and visited Akwesasne. I've done presentations here in Peterborough, visited Curve Lake. I've done presentations in Sudbury, visited Atikamek. I'm going out to Sarnia in a couple weeks, and I'll be visiting three different communities out there, including Walpole and Amjanang and Kettle Point. I'm very grateful and very fortunate to get to present where I am, and I'm very happy to be able to stay as involved with these communities as possible. Now, what is our vision at DFK? I said we wanted to make sure people could remember the nights they have to come, and I said the right reasons. Now, what I mean by that is that our vision, especially when we're looking at substance use, is to ensure that young people can live their lives free of problematic substance use and addiction. And that word problematic, it significantly matters here. Sometimes people hear the name of our program and they think that my job is to come in and tell people that drugs are bad and they shouldn't do drugs and drugs are wrong and there's a moral association to them. There's not. There isn't. Substance use isn't moral or immoral. Drugs aren't good. They're not bad. They don't know anything about morality. So if I was to come in and try to tell people that no one should be doing drugs, the difficult question arises, well, what's a drug? We know alcohol is a class 4 narcotic, damages every organ in the human body, causes 200 long-term and short-term health risks. We're going to talk a lot about alcohol today. If my job was to come in and tell people not to drink, what would I be saying to the audience who's listening that drinks alcohol? We know that tobacco kills half of the people that smoke from the various cancers that we know it causes. If my job was to come in and tell people that smoking is bad, what am I saying to the people that smoke, the people that listen who smoke, the people who listen who have friends that smoke? My job is not to try to tell you that you should or should not do drugs. My job is to remind you that you have choice. I do have to point out risks, I have to point out harms. And certainly it is I'll say a much more healthy option in many regards to limit or avoid the use of substances. And you'll see a lot of why today. But that being said, there are some that will listen, particularly those with young people, young teens, young adults, who may be going out to parties these next few months that substance use is going to happen. And we won't be able to guarantee that that won't happen. So if it does, my job and my vision is to equip those listening and those around them with strategies, knowledge, and information to help make more informed and healthier choices to maybe not, if not reduce the use of substances, which is certainly a hope. But if someone is going to use, how can we reduce the risks of them being harmed as a result of their use? And you'll see a lot of that as we go on today. Now, throughout these presentations, one of the things that we enjoy doing at DFK is offering some live polling, some survey questions. Now, since I'm doing a recording today for you, I won't have a live audience to be able to fire these back off at me, so I'll give you a few moments to read them. But the first question I have for you today is this. According to the American Automobile Association, CAA didn't have a number, I had to pull from AAA. How many teens between the ages of 16 to 19 report that it is likely that they or their friends will be under the influence of drugs and or alcohol during prom season? Now, it's worth noting that substance use rates in high school levels, if we look grade 7 to grade 12, really vary in terms of the substance used. But if we look at alcohol, we know that 2 in 5 people report drinking in the past 12 months. About 1 in 6, 1 in 5 report past year cannabis use. And as I said about alcohol, I said past month, I actually meant past year alcohol use. But if we look at the number here, how many teens do we think are going to be using drugs and or alcohol specifically during prom season? The answer is 30%, nearly 1 in 3. So, in other words, as I mentioned, you might say, well, this number is very similar to what we hear on an annual scale. Of course. But this is what the question that we ask annually is, have someone used at all in the last 12 months? What we know is that rates of substance use are not only reported among teens during prom season or among formal season or among party times, but they're widely expected and anticipated. It is a common time of year in the spring for young people to experiment with drugs for the first time, to try drugs for the first time, or to use more than they otherwise normally would. Did you know that over half of teens report drinking 4 or more drinks on prom night? That is 2.5 times the national average of Canadians who report doing so at any other time of the year. This is what I mean. I'm not saying substance use only occurs during prom season. I'm saying that we know it occurs at a greater rate. So, like I said, 2.5 times more teens report drinking 4 or more drinks, which would meet the criteria for high risk drinking or heavy drinking, versus the national average at any other time of the year. Now, drinking higher amounts of alcohol can expose a person to greater risks, including alcohol poisoning, passing out, hangovers, impaired driving, and hospitalization. Now, not only does alcohol consumption increase during prom season, but teens also report feeling more pressured to try drinking as well. Approximately 3/4 of teens say that they feel pressured by their peers to try alcohol on prom night, and about half report that their friends pressure them to try drugs. These times of the year can in themselves be exciting and stressful for teens. Now, the added stress of peer pressure on a highly regarded night like this can weigh very heavily on someone's well-being. This is where parents, guardians, and care providers have a distinct role. Your role is to take time before prom to talk about alcohol, to talk about substance use with your teen. And the workshop you're going to see here will help you understand how to do exactly that. There's a lot of different ways I can take this discussion today. So, in an effort to streamline this conversation, DFK has organized this presentation essentially into 3 sections. The first section is looking at what to do before the big night, before a party. Before we even get to the field party, the prom, the formal, the social event, whatever it is your teen is going out to do, we need to think about talking with them about the prom and after parties. We're going to discuss who is it that a parent can speak with. It doesn't just have to be the teen. There's a lot of other parties that can be involved in these dialogues and conversations to ensure a safe night. It's also what can we say? What language can we use? And we're going to speak a lot about language in this section to help further the conversation with a teen as opposed to creating conflict, confrontation, and judgment. The second thing is the night itself, heading out. We want to talk about things like sober transportation. We want to talk about the rules at a community event, the rules at a school function, the rules at any sanctioned event, any policies that need to be understood, particularly for sake of legal and social responsibility for the youth that are present. And not only the youth, but what about any parents hosting a party? What about any parents hosting something going on before the party? What do they need to know? Not only do we have to talk about the formal itself, not only do we have to talk about the prom itself, not only do we have to talk about whatever sanctioned event goes on, but for many teens that go somewhere like a large dance, a concert, party, they go to an after party. They go to somebody's house, they go out to a field, have a time for the rest of the night. This is a popular tradition. It's partying deep into the night or even deep into the morning. So, we're going to discuss strategies here about safe decision making, as well as how to help your teen in the event of an emergency. Things to identify, signs of harmful use of substances, signs of overdose, risks of mixing drugs, impact of certain substance use, way to protect someone from being put into a vulnerable situation. Really a lot to be covered here. And then I said there were 3 sections. The last one is just a questions and comments section, but for that, I'm just going to post a survey. And if you do have any questions, please feel free to put them out on the survey. You can pop in your contact info if you want. I'm happy to answer any that you have. What do we do before the big night? Well, not all conversations can be scripted. They can't. We don't go into a conversation with a young person saying we're going to jot down exactly everything we're going to say and make it fit exactly the way we want to. That's not reality. But If you have an idea of who you need to speak with, what you hope to accomplish, and what you hope to speak about, this can help simply shape the conversation. It can give you a starting block and end goals to consider. So, in this section, we will examine all of these topics, as well as where it is that you can go to learn more about substance use in general to help prepare yourself for what can be some rather difficult conversations. This presentation is primarily about the conversations that a parent or a guardian or a care provider can have with their own teen if their teen is going out to a party and event, of course. That being said, there are other people you may want to connect with even before said event to help prepare yourself and prepare your family as much as possible. There are several important figures with whom a parent or a guardian can speak with in the weeks that lead up to the big night, shall we say. Obviously, these include your teen. The most important conversations are going to be had with your teen. As a parent, as a guardian, you will want to keep these conversations casual. Frame them as a two-way conversation. Having conversations about substance use with a goal of lecturing your child is not going to lead you anywhere. All it's going to do is allow you to feel like you pushed a lot of information on them, and in many cases, they're going to tune you out. What's going to be more effective is structuring your conversation as more about questions, understanding what they know, pointing out concerns that you have, and allowing them to be able to address those with you. It's creating a conversation that is fundamentally based on both of you having a voice. And we'll talk about how you can do that while still getting across the points you want. But again, not just your teen. You're talking to your teen about going to a party at a friend's house. Who can you talk with? Well, you can talk to the party host parents. They're going to a party. You want to know where that's going to be. Connect with the host parents to see what sort of supervision is going to be happening at said event. What time are they expecting the party to be starting? And how long are they expecting the party to go? It's important to have an idea of a structure in the evening. When are things starting? When are they ending? This can help you coordinate rides. This can help you coordinate safe travel. This can also help remind about the importance of setting things like limits and realistic guidelines for safer consumption, reducing risk of substance use. Because if you know there's a certain time of the night that people are going to be ending off and heading home, it becomes important to understand when is a good time to slow down, when is a good time to start to relax a little bit, to go home and get ready for rest. Now, you can also reach out to parents who've hosted before. What if you are hosting a party? What if you have a teen that wants your home to be that host venue after prom, that host venue after the formal, where you're going to be having a few, a dozen, several dozen, couple hundred teens showing up? Reach out to other parents that have hosted parties in the past. Ask their experiences, ask for tips, and confirm that the teens that you have coming have a safe and sober mode of transportation to and from said party. I keep talking about transportation. It becomes important to even talk about transportation in and of itself. A common practice for parents and guardians is booking limousines or professional transportation for their teens to prom and otherwise. This could be calling a cab. This could be setting up Uber. This could be a limo service. This could be a party bus. I don't know the situation that you have. Everyone listening is different. It becomes important to ensure that the company does not allow drinking in the vehicle, particularly if the youth that you have are underage, and confirm a backup plan for a safe route of travel in case a situation pops up whereby the company is unable to perform. This happens. I got married 7 years ago, booked a limo company, had it all set up for months. 8 weeks before the wedding, limo company got sold. Stuff happens. Change happens. We had to go find a new limo on 8 weeks' notice, by the way. My wife was much less than thrilled. We got it, and she was not happy for the days leading up until we did. You have to understand situations can change. Your team knows this better than anyone. How many times have they made a plan that plans have fallen through? They designate a driver, they go to a party, that driver decides to start drinking. They designate a driver, they go to a party, that driver goes home before they're ready. They call for a parent and ask them to come pick them up. Maybe that parent gets sidetracked, gets called into work, gets sick, has an issue with their car, or maybe starts using substances themselves. It becomes very important to have an alternative and ask your student, ask your youth what alternatives are available. Let them make those decisions. And if your teen has a peer or a friend who is their designated driver, offer to let that person connect with you as well in case they need support. Maybe something happens with their vehicle, or if plans for being the DD change. Plans change. That's okay that they do. But not talking about that and not facing up to that can lead to problems. So just keep an open line of communication. Now, before you have a conversation with your teen about substance use, you want to make sure you prepare yourself accordingly. The first thing to do is stay calm. Telling yourself that you won't lose it with your child. This is a very important strategy. Anger and hostility are not going to get you anywhere in any conversation. They come from a caring place in many cases. We care. That's why it can be frustrating when we see danger or harm pop up in someone's life. We're not angry at the individual that it happened. We're upset, we're frustrated that it happened. But showing that anger is not going to show that you care. It's simply going to show that you're angry. So stay calm. You're the parent, you're the guardian. It's okay to take the lead. Be kind, be simple, and be direct in the statements you make with your child. And above all, remember to tell them that you love them. If you're anxious about having a conversation with them, find some things to do that'll help relax you, not just them. These conversations can be uncomfortable for both parties. If you're going to be talking about substances, maybe think about doing it on a walk, doing it over a cup of tea, going to a restaurant you both like. Think about doing it at a time when you're relaxed, not when emotions are high. Second is the importance of being positive. If you approach a situation with shame, anger, and scare tactics, your efforts are going to be counterproductive. One thing we've learned about abstinence only approaches, just say no approaches, morality and substance use approaches, is that all they do is they create judgment, they come across as fear monger. We point out all these harms and these negatives so heavily that if a youth doesn't see them, we come across like we're lying, or if they do see them, they may become confrontational about it. So all that does is it creates more sort of argument than it heals. So instead, try to keep your conversation positive. Keep your conversation around their strengths, about what you value about them, why it's important that they stay safe. And even when it comes to the messaging that you have, the brain is going to better remember a positive message. For example, the importance of designating a driver, of calling a cab, of calling a parent, giving them options they can follow instead of simply giving them a negative message. Don't drink and drive. Because if you don't provide them with another option, that message of simply saying don't do it isn't going to lead. So keep the message positive. Third, remember to engage. Lectures cause your teens to shut down, get angry, or tune you out. I'm doing a lecture right now. I'm sure there are people that are relaxing, sitting back, enjoying it. There are some people that are getting a little tired. That's okay. They had a long day when you saw this. I know that a lecture can make anyone shut down. So instead, you want to try to engage in a respectful dialogue. You want to be upfront and you want to use language that both of you are comfortable with. You'll notice I jump back and forth from technical terms to just simply having a conversation. The way I present is not all that different from the way I speak outside of a workshop because it's important that the people who are listening know that these conversations need to be natural. So I try to present that way too. That's why I stumble over my words a little bit and don't really let it bother me. That's part of being engaging. It's showing that you're vulnerable, showing that you're human, and it's inviting them to have a conversation with you too. Again, find yourself a comfortable setting. Be willing to take a break. Maybe you're having a conversation about a party, you're concerned about substance use. Maybe they get defensive, maybe you get defensive. If you find the conversation starts to get heated, it's okay to take a break. Acknowledge your emotions and acknowledge theirs. I think it's best we take a break right now. Things are getting a little hot. Maybe we can resume this conversation tomorrow once we both have a chance to calm down and reflect on what's been said. Why? I don't want to say something that could be taken as hurtful. I came in with this conversation because I care and because I'm concerned. I didn't do it to argue with you. Let's have that conversation when we can come back to that message. So, knowing even a little bit about substance use can help you feel more comfortable with sharing knowledge. And if you ever want to learn more about any type of substance provided, we carry a ton of resources at DFK. You can visit our website, drugfreekidscanada.org. Shameless self-promotion number one. But the reason I mention it is that knowing even a little bit about substance use can help you feel more comfortable. Just like I said, if you feel like you don't know enough, say you want to talk about drugs at a party, you think that might happen, but you don't know what's going on with drugs. Ask kids, what have they heard? What are they seeing? They see these things. So ask them what's going on. Allow them to be a bit of the professional as well. Keep it casual. Ask your teen when it's a good time to talk. And if they say not now, okay, try again later. But don't give up. You can check back. It doesn't mean you have to check every couple hours. Check in after a couple of days. Check in after a few days. There's a difference between checking in because you care and being overbearing. You don't have to force this conversation. Keep it relaxed. Make your expectations clear. You want to begin an ongoing conversation about substance use. That's an expectation. You want to express concern. That's a real expectation. You want to gauge how they feel and what they know about substance use and learn about the pressures they may be facing with drugs. Like I said, this is a season. These next few months, these next 8 weeks are a period of time that youth may feel more pressure to try substances than any other time of the year. For some, than any other time of their life. So ask them about that. How do they feel? Why do they feel that way? Explain why they feel that way. Invite them to do that. The language you use is also important when you talk with youth about drug use. Consider the use of non judgmental language. I'll show you what that looks like in a moment. Use open ended questions. Do you know what an open ended question is? I'll give you a hint. That was not an open ended question. Asking yes or no questions, like the one I just used, it's called a closed ended question. It ends a conversation before it begins. Are you going to be drinking this weekend? No. What do you do with that conversation? Well, nothing. But if the conversation becomes, what are you looking forward to doing this weekend? What are you getting up to this weekend? Provide a little bit more details. What are you and your friends doing? Where are you going? What are the plans? Right? That invites more of a conversation. It encourages your teen to share more information voluntarily. Offer empathy. Show your teen that you're trying to understand how they feel. If they tell you something, say they talk about stress, say they talk about pressure, say they talk about it's been a long year at school and this is a time they get to go out and party, they just want to unwind, you're really glad that they told you that. They're being vulnerable with you. Don't shrug it off and be like, stress happens. No, no. Show them that you're trying to understand. Listen, ask questions, and summarize what you hear. The language that you use, I mentioned this a moment ago. You want to practice your language. Certain words that you use can have a negative influence over an entire conversation. I'll give you an example. Your teen's going out to a party. Maybe they talk about smoking cannabis, smoking weed. And you say to them, smoking weed can cause a person to make bad choices. Or if they say they're going to be drinking, well, you know, drinking a lot's pretty stupid, right? That language can come across as quite judgmental. So, what could you say instead of words like bad or stupid? Instead of focusing on morality and intellect, because those first two words can come across as pretty insulting. If I say smoking is bad and you smoke, to you, I'm calling you bad. If I say drinking is stupid and you drink, I'm calling you stupid. But if instead of focusing on words like that create this sort of sense of judgment, focus on health. Getting high, smoking weed can cause a person to make harmful choices, risky choices. That's different than attaching morality to the statement. Harm and health are different than good and bad. Heavy drinking is not stupid, it's unhealthy. Well, why is that? Well, now you can talk about overconsumption, blacking out, vomiting, hangovers, the hospital, right? That's different than attaching a morality or insulting a person's intelligence. So, like I said, when you use the words on the left, they sound like you're trying to identify the person that way. You're not. You're trying to keep the focus on the substance and identify the person separate from them. So use the words on the right. Next up, instead of saying I disapprove of the group you want to party with, or I'm disappointed that you got home late, people go out to parties. Sometimes they say they're going to get home at 11. Sometimes 11 becomes 12. Sometimes 12 becomes 1. Sometimes 1 becomes 2. Get home very late. First thing they hear, or the thing they hear the next day, is I'm disappointed you got home late. I don't approve of you being home so late. The problem is that language can sound like you're coming across as judgmental to the individual. Instead, think of this. I'm concerned about the group you want to party with. Well, why are you concerned? They may not have the best influence on your behavior. Wow, we can talk about that. Instead of saying I'm disappointed that you got home late, I was worried about you. Disappointment and disapproval come across as condescending. But what's worth noting is that those responses that we have, when we say we're disappointed in someone, think about why we are. What emotion is it that we're conveying through disappointment? It's concern. I was worried something was going to happen, and maybe it did. But even if it didn't, that worry has hurt me. So I'm responding by telling you I'm disappointed in you because I'm passing that hurt on to you. Instead, bring up the fact you were worried. That shows much more accurately what you're feeling, and it doesn't just pass that feeling on to them. It lets them see it, but it's not about creating guilt for them, right? It's not that I'm disappointed you got home late. It's I'm worried you came home late because this. According to our Drug Free Kids tracking study, most recently actually done in 2024, but it was the same in 2022, which of these were considered by teens to be the most reliable source of information about drugs? Was it parents, school, websites, or friends? What do we think? You guys, a few moments. The answer is parents. Parents came in at 67%. Two-thirds of teens that we surveyed across Canada in 2020, 2022, 2024 said that the influence of friends and peers cannot be overstated. We know that. where they hear about substances, where they hear about drugs online from their friends. They hear it the most. That is not what we're saying. What we're saying is the information that they trust, the things that they actually believe about substances, primarily comes from their parents and their educators. So your voice matters. That's why it's important for you to hear this today. That's why it's important for you to have a voice in this conversation, because your voice still resonates with them. Even if they're rolling their eyes at you once in a while, even if they're saying, I don't want to talk about this, they may not want to in that moment, but statistically, they're going to trust you more than anyone else on this conversation. Now, as we mentioned, teens listen to parents and guardians more about drugs than anybody else. That can sound pretty daunting, especially if your own knowledge about drugs and alcohol is limited. No parent is expected to know everything about drugs. No guardian is supposed to know exactly how drugs can affect the lives of a child. So for that, it's where we can help. On our website, we have a free resource powered through TELUS Mental Health called our Parent Support Hub, which is available 24 hours a day, 7 days a week through online messaging or phone. You can call them at 1-866-381-1511, or you can visit our website, drugfreekidscanada.org. And the Parent Support Hub that you see here is specifically designed for family members who are concerned that a youth is using substances or a youth may experience harm as a result of substance use. Here, they can actually connect with a health professional and be booked for up to 5 free counseling sessions, often with very little or no wait list. Very helpful, very discreet, free resource for families in Canada. So, again, your voice matters, but if you don't know what to say, give us a call. We're happy to support you. Now, prom season, grad season, party season. I mean, any season can be party season. But parties are a time for teens to celebrate and to feel a sense of accomplishment, to feel a social sense of wellness. And in the case of things like proms, in the case of formals, those end of school year celebrations, it's a time for them to get ready for the next big steps in their life. This night should be memorable. Here, what we're going to do is discuss the things you want to make sure that they can remember it for enjoyable and positive reasons. So, before your teen heads off to that party, whether it's a prom, whether it's Saturday night, whether it's Friday night with the buddies, it's important to remember there are certain topics you need to consider. Things like pre-drinking, sober driving, and the rules and regulations of whatever event they're going to. If it's a community event, if it's a school-sanctioned event, whatever it is, they need to be aware of these things before they even leave the house. So, one of the things we often ask in our presentations on substance use, and we have many that talk a little more about the history or nature of a given substance. Today is more so about conversation around a party and substance use. But if I was simply defining tobacco use or cannabis use or ketamine use or opioid use, one of the things I'd often talk about is, why do you think people use drugs? So I'm going to ask a similar question here. Why do you think that teens might drink or use drugs before they go to an event like prom? Now, the reasons that they may provide, or the reasons you may come up with, could be something like this. They're fun. They can create feelings of excitement, pleasure, arousal, energy, focus. Some people use because they can't use substances at an event. I mean, there's adults that do this. Why do we drink at home before we drink at a restaurant? Well, because buying a beer at a bar is like $45 right now, and buying one at home is only 2 or 3. I realize it's not $45. My point is, there's a great markup. But for teens, it could simply be they can't get their hands on it at an event. So if they want to use substances, and we create policies to make sure that they don't, schools do this, community events do this, that's important. But if youth want to use, they may choose to use before they even get there. So if a teen is planning or intending to use drugs, again, doing so at a prom may get them into trouble with school or the police. So they might use at home or at a friend's house before they go. Now, the third thing to remember is, given the amount of planning, the money spent, and the social aspects that go into any community event, think about the cost to go to a concert with your friends. Think about the cost to go to formal. Think of the cost for the adults listening, think of the cost to go to a wedding. The need for a suit, the need for an outfit, the need for travel, the need for a hotel accommodation. There's a lot of money that goes into that, a lot of planning that goes in, not just for the host, but for anyone going. It's no different with formals. It's no different with parties. A lot of that can create stress. A lot of that can create tension. A lot of that can create anxiety, especially for young people that are still getting used to this side of things. Now, coupling that with something like an upcoming graduation, impending exams, school projects, work, relationships, all that stress on top of it, floating around in the back of their mind, Using drugs or alcohol may be a coping mechanism for teens who do not want to think about these things. So, if you are discussing pre drinking or people using substances before they go to an event, consider asking things like, what are you looking forward to most about tonight? Ask them to think about what makes the evening so special, what makes the event so special. Could be going with friends, could be the food, could be the dancing, could be the spectacle, could just be the joy of getting to go somewhere to celebrate. Now, whatever the reason, you can then ask how alcohol or drugs might affect those things. Are they necessarily going to improve them? Are they going to make them more memorable? Could they potentially incorporate any risk? Second, what are the school rules about drug and alcohol use? We mentioned earlier that youth may use drugs or drink before an event like prom because they can't do so at the event. After all, prom is still a school function. In many cases, many schools sanction these, not all. But that is worth considering that if there's supervision or catering from, say, teachers, volunteers, that there are still rules and regulations that need to apply. So, for example, if a student is suspected of being impaired by drugs or alcohol, they may be denied entry into an event. This is no different than going to a hockey game, than going to a concert. Any of those events, you can be denied entrance if you are deemed too impaired or suspected of being heavily impaired. Furthermore, if you are caught drinking or using drugs at these events, particularly if you're underage, you may be sent home suspended or deemed unable to attend any remaining events through a school, such as graduation. In some cases, depending on the event, a youth may even face criminal charges for things like possession or trying to buy or sell drugs at an event. And finally, what if a youth says that they're using because they're stressed? Well, then it's a conversation about what are some other ways to manage stress. And we talk about this in far more detail in any other presentation that we do. But I do want to note that giving alcohol or drugs to teens is illegal. And anyone who provides alcohol or drugs in their home and allows substance use can be held liable for these guests not only while they're in the house, but if they do something like drive to the venue afterwards. For instance, if an adult gives alcohol to a teen who then gets behind the wheel of a car and goes to a party, that adult can be held liable in the event that the teen is involved in a collision or pulled over due to impaired driving. According to the government of Canada, the percentage of Canadian drivers killed in vehicle crashes who test positive for alcohol is higher or lower than those who test positive for drugs. What do we think? So the answer here is actually lower. Alcohol is actually the number two leading substance found in dead and injured drivers in Canada behind cannabis. Now, impaired driving is the leading cause of criminal death for teens in Canada. In the United States, the number of impaired fatalities among teens is the absolute highest during prom and graduation season. However, while we know that there's a high stake around these parties and the potential for substance use, and teens may face this pressure that we talked about earlier. They may choose to use. And we've had this conversation about sober and impaired driving. One thing that we found is that nearly 85% of teens would rather drive impaired than call a parent for a sober ride home. Now, why do they avoid making that call? Well, research suggests many different reasons. This can include a fear of getting in trouble for being impaired. Other teens who drive or get into a vehicle with a cannabis impaired driver, for instance, may believe that cannabis isn't as risky or as dangerous to consume before driving as alcohol, even though, as I mentioned a moment ago, cannabis is actually found now in more dead and injured drivers than any other substance. But whatever the reason, it's crucial to ensure that your teen is aware of the risks of impaired driving and that they have a plan for safe travel. If they're worried about getting in trouble, if they're worried about feeling embarrassed, then you give them options of who else they can connect with for that sober ride, and you help them set that up. So, if you're discussing impaired driving, how do you think alcohol affects driving skills? How do you think cannabis affects driving skills? We know that both impact things like judgment, reaction time, focus, clear vision, coordination, consciousness. We also know that these substances can increase the risk of fatality by varying amounts. Driving impaired by cannabis increases the risk of fatality by 5 times. Driving impaired by depressants, such as anti anxiety medications, sedatives, things like that, can increase the risk of being killed in a collision by up to 8 times. And it's also worth noting that in the case of cannabis, 1 in 4 Canadians who use cannabis say they have operated a vehicle while under the influence. That is 4 times higher than the 6% of Canadians who report driving within 2 hours of drinking 2 or more drinks. So, again, work together with your team, identify risks of substance use, and help them set up safe travel plans. True or false? School officials can search a student's property at an event if they have reasonable grounds to suspect a school rule or law is being violated. Well, the answer is true. In many cases, proms are school sponsored. Many of them are held at schools. Many of them are coordinated by schools with the help of faculty, with the help of teachers, with the help of many volunteers and professionals. Therefore, the presence of teachers, of educators in an event like this can often mean that the expectations remain consistent with a regular school day. Students can face suspension and or criminal charges for things like attending an event while impaired or by possession or buying or selling drugs. Give you an example of this. About 6 years ago, in 2019, a student was found in possession of cocaine and charged after having her bag checked at a security line at the hall where prom was taking place. The school had printed on the entry tickets that drugs and alcohol were prohibited, and the students had agreed to a brief bag check before being allowed in. The school vice principal, when checking the student's bag, found a small straw in the student's bag, which aroused suspicion and prompted a further examination, leading to the discovery of cocaine. The Ontario courts ruled that while the student had a reasonable expectation of privacy, which is what the student's defense team tried to use, the response was that this was lessened given the situation. And the school's mandate was to ensure safety and security of the attendees. Therefore, once again, if the teacher or the principal or the individual checking the bag is able to show that substance use presents a real danger and immediate risk to those present, then seeing something that would lead them to believe substance use could happen can be grounds for a further check, suspension, punishment, penalties, and even legal ramifications. And it's important students understand this. If they're going to think about using substances, they should not be bringing them to a public event. And that's not just schools. That could be things like sports. That could be things like concerts. Do not bring them to the event itself. Your kid goes to a party. Your kid goes to prom. Your kid goes to formal. Your kid goes to a concert. Now, the end of the event does not mean the end of the night for many teens. After parties are a common activity for young people to keep the celebrations rocking right through the night. These events can be memorable, they can be a lot of fun, but they can also present some pretty unique risks. So, in this very last section, we're going to examine what those risks are and how to prepare your youth for a safe and fun partying experience. After parties can be a lot of fun. They can be even as exciting or even more exciting as the event itself that your teen just went to. So here are some of the things to make sure you want to discuss to help ensure that safe experience. Helping protect themselves. You'll see what I mean in a moment. How much is too much? What happens if someone uses too many substances? What happens if they mix them together? And what happens in the event of an emergency? What happens if someone you're with gets sick? What happens if someone you're with passes out? What happens if someone you're with gets hurt? We want to make sure that the host, the individual, the teen, everyone there is in a position that there is a way for them to respond effectively to these emergencies. Parties and social gatherings are commonplace, and teens celebrate this rite of passage together. However, there are occasions where people may choose to engage in unsafe or harmful behaviors towards each other. Unfortunately, one example of this is sexual violence. One AMA study reported that about 1 in 5 female high school students reports being the victim of a physical or sexual abuse on prom night. Now, the risk of being victimized is increased when alcohol and drugs are involved. The majority of sexual assaults in the United States involve alcohol, and we also know that in Canada, approximately 30% of all women aged 15 and above have been sexually assaulted outside of an intimate relationship at least once since age 15, and over half of these victims know the perpetrator. A study from McGill University, actually, on one of their sites, I was reading just a couple months ago, mentioned that approximately 90% of all sexual assaults that take place on college university campuses across Canada involve alcohol. Either the perpetrator was inebriated, the victim was inebriated, or both. Alcohol is the most common drug by far implicated in sexual violence. Now, it's not the only drug to consider when discussing sexual violence. Drugs that may lead to drug-facilitated sexual assaults, otherwise known as date rapes, could include things like gamma-hydroxybutyrate, known as GHB, as well as rohypnol or ketamine. Ketamine is a hallucinogen, but it's also meant to be an anesthetic or a sedative. GHB and rohypnol are also sedatives that can be used by sexual predators to spike the drink of an unsuspecting victim. Now, in the next few slides, we're going to discuss how to spot signs of an overdose, including signs that a person has been drugged by these substances. It's also very important that a youth understands not just the importance of protecting themselves, of protecting their drinks, of setting limits to how much they drink, of taking breaks from drinking, of celebrating events sober. But it's also important that a youth who is considering something like this is aware of the fact that using a substance to commit a sexual assault is not only dangerous and not only traumatic to the victim, but it is extremely illegal and can result in up to 14 rather years in federal prison, plus any additional charges, including sexual assault itself. Extremely dangerous, extremely illegal. So when it comes to the after party, focus on safety with your team. You talk about the importance of reminding them to pour their own drinks, go get their own drinks. And not only to protect their drinks, but to set limits on their drinking, because it's not GHB and Rohypnol that are most commonly implicated in sexual violence, it's alcohol itself. So it's the importance of taking breaks from drinking, of knowing a person's limit, of slowing down if someone starts to feel inebriated, taking breaks to have water, taking breaks to have food, staying in a safe space, a public space in particular, with people that you trust, making sure that no one is going off alone with someone, especially if you don't know them, and being willing to call home if you feel unwell. Using which of these substances can result in an overdose? Is it alcohol, opioids, cannabis, or all of the above? Now, many people will see this and they'll say opioids right away. Opioids are extremely dangerous. We're going to talk about that. They might say, well, alcohol too. But then I'll hear people say you can't overdose on cannabis. You can, because it's important to note that overdose does not mean death necessarily. Overdose, by definition, is caused by consuming more of a substance than a person's body can safely process, which can result in various unwanted, harmful, or dangerous effects. Now, fatality is part of that, but in the case of cannabis, this can include things like cannabinoid hyperemesis syndrome. This can include things like substance-induced psychotic episodes, vomiting, heart palpitations, fever. What's it include for the others? Well, with alcohol, we know that overconsumption can cause things like dizziness, nausea, stupor, vomiting, dehydration, weakness, headache, slurred speech, passing out, coma, reduced heart rate. With cannabis, it's dizziness, heart palpitations, fever, nausea, vomiting, trouble with breathing, dehydration, delusions, hallucinations, difficulty with memory, judgment and problem solving. And for individuals who have a history or a predisposition to psychological disorders, there's an increased risk of psychotic episodes. This is also the case among individuals who use cannabis during their teenage years and individuals that use higher potent cannabis products such as vaping and cannabis extracts. Signs of an opioid overdose include clammy skin, pinpoint pupils, drowsiness, passing out, slowed breathing, or the inability to breathe or no heartbeat. And finally, stimulants, cocaine, methamphetamine, prescription medications like Vyvanse or Ritalin or Dexedrine. Overconsumption can include seizures, psychotic breaks, hyperthermia, labored breathing, convulsions, coma, high blood pressure, as well as heart attack and stroke. Now, if an individual experiences any of these symptoms and they require medical assistance, it is important that they get it, particularly if we look at opioids. Your teen's at a party, someone they know has used fentanyl or heroin, or they didn't know that they did. They pass out, they stop breathing. Their lips begin to discolor, their eyes become very small, their breathing becomes shallow, their breathing stops altogether. In the event of this sort of an emergency, it becomes very important to call EMS, to call 911, but also to respond to the overwhelming risk of an opioid overdose. There is naloxone or Narcan. Now, Narcan is available as a nasal spray or as an injectable. It is non-allergenic. Multiple doses can be given to a person with no adverse effects. It will temporarily reverse the effect of an opioid overdose within 2 to 5 minutes, but it only lasts about 20 to 90 minutes, while an opioid overdose can last several hours. So if you are at a party, if your team's going to a party and they suspect someone's overdosed and they hear someone say, or they choose to use Narcan to administer to try to get this person to start breathing, even if the person wakes up, they still need to call emergency services because the Narcan will wear off before the opioid does. So the overdose will go away, but then it will come back. Now, mixing other drugs with opioids, especially alcohol, can complicate the effects of Narcan. Alcohol slows the body down. So someone that takes fentanyl or heroin that stops breathing, that their lungs fail, it's not necessarily that their lungs have failed, it's that their brain isn't sending the signal to get the lungs to start again. So if a person administers Narcan to try to make that person start breathing, it may reverse the effect of the opioid. However, the alcohol present in their system, especially if they've consumed a high amount, may keep their breathing weak, may keep it irregular, and it may keep their heart rate low, which may mean that the opioid can come back on even quicker, meaning that the Narcan either will not wake the person up, will not get them necessarily to start breathing, or even if they do, they may pass back out in a shorter period of time. Which of these substances do Canadians age 16 and above report mixing with cannabis at the higher rate? Is it stimulants, alcohol, tobacco, or hallucinogens? Number one answer is alcohol at 63%, followed by nicotine products, followed by hallucinogens, followed by stimulants. Now, why do I have to point this out? Mixing substances is a popular option for people at parties, especially alcohol and cannabis. Now, the risk of mixing these drugs together includes an increased risk of things like cannabis and alcohol poisoning. In the case of cannabis poisoning, this is also known as greening out, and I showed you all those signs earlier. Both cannabis and alcohol have what's called a diuretic effect, meaning that they cause dehydration. This is all that really largely causes the effects of a hangover. The weakness, the headaches, the stiffness, the nausea is severe dehydration. Using cannabis as well increases the risk of dehydration. Now, mixing both these drugs together can also increase the risk for a need for emergency services or hospitalization. So it's recommended that if you know a teen who plans on drinking or smoking at a party, that if they are choosing to use, they avoid mixing drugs together. And if they're going to mix, that they use less of both than they normally would because the effects are going to be stronger. Now, mixing cannabis with other drugs can cause unsafe changes to blood pressure. This includes stimulants, sedatives, and many medications. This is why it becomes very important that anyone who's using cannabis and a medication, or a medication and then cannabis, needs to speak with their doctor to ensure that they will not experience any potential cardiac related issues as a result of mixing together. Now, in the event of a party, someone mixing cannabis with, say, hallucinogens, mixing cannabis with cocaine, mixing cannabis with methamphetamine, may be more likely to experience psychotic episodes, delusions, hallucinations, break from reality. Mixing with things like alcohol, mixing with things like sleeping pills, with Gravol, with fentanyl, with heroin, can increase the risk of passing out, sedation, coma, and lung failure. Finally, we have mixing alcohol with other drugs. Alcohol mixed with other stimulants can cause offsetting effects. We also see a risk of weak breathing, mixing alcohol with sedatives. A person may choke on their vomit if they've mixed alcohol in another drug, especially if they've passed out. So if someone has passed out and you suspect they have alcohol poisoning, it becomes important to put them into a recovery position so that they're not aspirating their vomit if they do throw up. Now, finally, as I mentioned before, mixing alcohol with fentanyl, mixing alcohol with heroin can greatly increase the risk of coma, but can also greatly increase the risk of fatality. Lots to unpack there. And if you ever want to learn more about this stuff, like I said, drugfreekidscanada.org, you can find a lot more of information here. We also often book many different presentations just on substances, but starting the Coles notes, what you need to understand. So mixing drugs and alcohol together can be fatal. So if you want to have that conversation with your teen, ask them, why do you think people mix drugs? What do you think might happen if you mix alcohol with cannabis, cannabis with fentanyl, cocaine with alcohol? And if they don't know, in many cases they won't. Urge them to look it up with them. A lot to be learned here. Many of us don't understand this, even though 1 in 6 teens, according to the most recent Canadian Student Tobacco, Alcohol, and Drug Survey, report mixing drugs together at least once in the past 12 months. So make sure you're willing to help, even if you suspect drugs and alcohol are involved. Now, my last question for you. If emergency medical services is called to treat a person for overdosing on drugs, the person will be charged for being impaired or for possession of a substance. Accept this, challenge it. What do you think? You definitely want to challenge this one. In Canada, we are protected under what is known as the Good Samaritan Overdose Act. This offers some legal protection for those seeking help during an overdose, including things like possession or breach of conditions. The reason I point this out is if a youth goes out to a party, a youth goes out to an after party, a youth goes out to a field party, whatever have you, substances are used, someone gets sick, someone passes out, someone gets hurt. There can be a fear of calling because they don't want to get in trouble. They don't want to get themselves in trouble. They don't want to get someone else in trouble. However, when the risk of fatality is significant, which, as we see with the current drug market, it is, this is important, especially with things like sedatives, stimulants, and opioids, which could be used at an after party, which could be used at any party. So, therefore, in 2017, the Government of Canada signed into effect the Good Samaritan Drug Overdose Act. Anyone who calls emergency services in response to an overdose is legally protected from charges against simple possession, or breach of conditions related to release involving possession. In other words, if a person calls for help and they have a small amount of a substance on them, or if they've taken a legal or illegal substance, they will not be charged criminally for doing so. because the risk to their life supersedes the need to charge them. Now, the act is not a get out of jail free card. It does not protect against other crimes. This includes outstanding warrants, production or trafficking of other drugs, or other crimes not included above. So, in short, if your youth sees or experiences an overdose or suspects they are, it is okay for them to call for help, to call emergency services, to call 911. It will save a life. So, if your teen ever finds themselves in an emergency, make sure they understand what an overdose looks like, how to call 911. If opioids are being used, and we find ourselves increasingly in a reality where many youth are aware that opioids are being used, in many cases, they may have started using. It becomes important they understand what Narcan is or naloxone and how to administer it if necessary. And if they are with someone who is overdosed, if they are with someone who's gotten sick, it's to keep them somewhere safe, somewhere public, whereby they're not being taken off alone with someone, especially if they're vulnerable, that they can have someone, a couple people with them to keep them safe until help arrives. So let's review. We talked about all of this today, and safety starts with you. We talk about it with teens. We're teaching them to stay safe. The way we do that is we exemplify it. We ask them questions to encourage them to share their knowledge, to review what they know, to help build on that. We show compassion. They don't know everything, neither do we. This is a lot of fun coming up. They're coming up on party time. This is going to be a great time of the year for them, but there are risks they need to consider. Be compassionate to their feelings. And remember, they're coming up on a time of the year that they've been working on projects all year. Like I said, they got exams coming up. Maybe they're working at the same time. Could be going to college next year. Could be going to university next year. There's a lot of stress bubbling around in there. Show compassion there. Show empathy. These conversations are not easy, but they need to be had. Confirm plans. Set a curfew. Be upfront about that. Structuring an evening whereby knowing when the party starts, when the party ends, is important for both of you. Focus on safety. Be willing to help, even if drugs or alcohol are involved. Some parents say it's helpful to tell their kids, if you're going to use drugs, don't come home. Well, what you've done there is you've taken a safe space away from them. So where are they going to go? Does it mean they won't use drugs? Or does it just mean that you're not going to see them that night? Or possibly the next day, or possibly ever again? Be willing to help. Remind them that they have a safe space. You may not be happy about it. I'm not telling you to be happy about it. But make sure they know they have a space to be safe. And you can have the conversation about substances once they've sobered up, once they're no longer hungover, have it when they have a more clear state of mind. Then you can talk about if there's a need for consequences or ramifications. But give them a safe space in the moment. They need that. And if you're hosting a party, do not serve alcohol or drugs, particularly to underage youth, and keep Narcan or naloxone on hand in the event someone is using heavy substances. Consider reasons for use. Make sure people have sober drivers. Encourage them to stay with people that they trust. Avoid mixing drugs. Encourage them to take breaks or attend events sober. You do events free of substance use. Do not take drinks from someone else, especially if you don't know who they are. Know the signs of overdose and call emergency services. I want to thank you all for joining today. I certainly hope that this has been a beneficial opportunity for you to learn. We certainly hope that you visit our website, drugfreekidscanada.org. Shameless self-promotion number 3 or 4, I can't count. But you can visit our website, supports dialogues with family, helps highlight the issues with things like opioids, things like vaping, hallucinogens, DUI, provides information on various substances, has our aforementioned parent support hub, and you can always book things like workshops or webinars with me. So otherwise, I hope that you enjoy the rest of your day, and thank you very, very much for taking part in our presentation. Take care, everybody. Bye-bye.